Our knowledge and truth for a healthy living is a must. Here are the experts. Here are the facts. Here is what we testify to and speak. This is We Shop Talk. Africa.
It's day 5, ladies and gentlemen, and we're in Abeokuta. We left Shagamu, about an hour's drive, to come to serve the citizens of Abeokuta. We are split into 2 today, conducting our community health event screening. One here in Ake, where the paramount ruler, Oba Gbadebo, is hosting us. We're seeing close to over 400 for blood pressure check, diabetes screening, cholesterol check, prostate cancer screening, and also colon cancer screening. The Royal Highness, the Oluwo of Owu, the King of Owu, also really wanted us to be there today. So we had to split all our personnel into 2. And we've been doing this now probably for the last 4 hours. We have more in Owu. Over 500 clients have been seen. And get this, we're also enrolling 1,000 in Egbaland, 1,000 indigenous of Egbaland, who are indigenous of Ogun State, in the Ogun State Health Insurance Scheme. And get this, for all of them, they'll also be able to get prescriptions for those who have newly diagnosed medical conditions from here in Ake or in Abeokuta. I just came back from the Federal Medical Center, Abeokuta, where Dr. Alan Pickens did a PDA ligation on a 10-year-old yesterday. He also had a lobectomy on a lady that had recurrent issues with her lungs. Those are recovering very well in surgery. Today, Dr. John Louis Ugo, again, heading our orthopedic surgery unit, is still operating in Shagamu at the Olabisi University Teaching Hospital. Same thing with Dr. Shino Faole, who heads our general surgery unit. And then we have Dr. Gundele, who is also doing some pediatric urologic procedures. All of this is coming together, and we're slowly going to start wind down as we head to day 6. It's going to be a day of visitation. We're going to play a courtesy call on the ex-president of the Republic of Nigeria, Papa Olusegun Obasanjo, and we're also going to take a tour of his library. We're also going to have a courtesy call to the Oluwo of Owu, His Royal Highness Oba Matemilola, who has also invited us to come and spend some time with him. And then on our way out of Abeokuta tomorrow, we're going to be paying a visit to Anikulapo Kuti, that is formerly Ransom Kuti's, the father of Afrobeats, to pay a courtesy call, not a courtesy call, but a visit to his ancestral home here in Abeokuta. This has been fantastic. The staff have been absolutely gracious. We have here today that we brought from Shagamu close to 90 volunteers. And then we had volunteers who also joined us, all from within Abeokuta. We have community health care workers who joined us. We had student nurses. We had nurses that have also been with us. This has been a full-throated operation. We've had in total close to 160 volunteers working with us today. It's been fantastic. A lot of good has been done. People are very pleased. And we hope, of course, to continue to duplicate this as we move forward. The platform is set by the Global Health Charity and Training Foundation. We're looking forward to, in the next 30 minutes, His Royal Highness Oba Gbadebo, the paramount ruler of Egbaland, will be meeting with us between 4 to 5 p.m. And after that, we head on back to Shagamu. It's been a fantastic day, a day of quality services rendered, and lots of happy people here in Ogun State. Stay tuned as we move on to day 6 tomorrow.
Good day. Thanks for joining us on episode 10, part 2 of We Shop Talk. We're coming to you directly from Shagamu, Ogun State, Nigeria, where we've been on a surgical, medical, interdisciplinary mission trip the last 6 days. The first segment of this episode was devoted to talking to the surgeons, the cardiothoracic surgeon, the orthopedic surgeon, and also the gastroenterologist who was this mission trip with us. This mission trip was put together by the Global Health Charity and Training Foundation, based in the US and in the UK and also in Nigeria. And we're very thankful to the collaborative efforts that we've received from entities like the Olabisi University Teaching Hospital, the 400-bed hospital in the heart of Remoland in Shagamu, the Federal Medical Center in Abeokuta, and also the State Hospital in Ijebu-Ode. This segment actually focuses on the medical component of the mission trip. We had a consultant cardiologist, Dr. David Gbadebo, who was part of this mission trip, a consultant cardiologist from Emory University in Atlanta. Also the rheumatologist, Dr. Deji Olajide, who joined us too from the University of Vanderbilt in Nashville, Tennessee. The other component of the medical piece is a community outreach, which we're going to be talking about in just a little bit. Well, let me introduce to you our distinguished panelists here today. To my left is Dr. Akintobi, who is a consultant family physician at University College Hospital, Ibadan. Kuti, thanks so much for joining us.
Thank you for having me.
Next to Dr. Kuti is Dr. Xavier Brown, a clinical pharmacist and pharmacist entrepreneur out of Atlanta, Georgia, United States. Dr. Bryant, thanks for joining us.
Thank you for having me.
And last but not least is Dr. Deji Olajide, a rheumatologist, like I said, out of University of Vanderbilt, Nashville, Tennessee, in the United States. Thank you all for joining us. This medical mission trip has been about a week. What informed your decision to be part of this, Dr. Deji Olajide?
Thank you very much. So, giving back has always been part of my mantra, and this week actually has been a combination of a years-long dream. We've had many specialists come together, and we're joining the dots, and really I cannot be any happier than I have been this week with how things have turned out. So I'm very happy to be here.
Same question to you, Dr. Brian, knowing that this was your first trip to the continent of Africa, and particularly Nigeria. What informed that decision?
Well, honestly, I've been dreaming of coming to Africa ever since I was a child. So when the opportunity presented itself and all things were aligned, I had to jump on it. But at the same time, the opportunity to represent pharmacy within this multidisciplinary missions trip was near and dear to me, just to make sure that pharmacy is present along with all the other specialties that are present. And then while being in Atlanta, this is something that we do that's near and dear to my heart as far as taking care of the homeless population, taking care of individuals who don't have insurance. So understanding that we were doing this internationally, I said I want to take my skills and make sure that I can help someone else.
Thank you so much, Dr. Bryant. And to you, Dr. Akintobi, coming over from a sister teaching hospital, what informed the decision?
Thank you, sir. Like I've told everybody before, I didn't know about this medical missions at all. I just got to know about it about 3 weeks to 4 weeks ago. And that's because one of the organizers is my uncle, his family. And he just mentioned and said, well, I'm coming to Nigeria for this medical missions trip. So, you know, I didn't think about it initially, but I was like, wait a minute, are they taking volunteers? Like, I really want to volunteer. Like you said, volunteering has always been something I love to do, giving back, you know, and I did a lot of that as a medical student with the Christian Medical Mission, but not so much since, you know, residency, motherhood and all that. So I just found it an opportunity and I was like, come on, I want to take a 10-day summer break. Why don't I just dedicate this time to this medical missions? My uncle is also someone that inspired me to study medicine. We grew up in the same household. So I was like, what's a rare opportunity to have him come all the way from Atlanta, 2 members of the family coming to volunteer, you know, for a good cause. So that's why I'm here.
And we're in Abeokuta. We left Shagamu about an hour's drive to come to serve the citizens of Abeokuta. We are split into 2 today, conducting a community health event screening. One here in Ake, where the paramount ruler, Oba Gbadebo, is hosting us. We're seeing close to over 400 for blood pressure check, diabetes screening, cholesterol check, prostate cancer screening, and also colon cancer screening. And we're duplicating this simultaneously in Owu.
I'm Dr. Xavier Bryant. I'm a clinical pharmacist out of Atlanta, Georgia. I'm delighted to be here. This is my first time actually being in Nigeria, my first time on an international mission. So to be able to give back to my people matters the most to me. As was stated earlier, this is the African part of my African-American experience, and I just want to make sure that I'm giving back however I can give back when it comes to healthcare, when it comes to the free services that we're delivering, when it comes to blood pressure checks, blood glucose, cholesterol checks, and also when it comes to just the delivery of free medications. It is a definite gratitude to be here, and I thank you.
What was your role in the community health screening? Tell us, our viewers, what exactly that was all about, and how challenging was that to piece together events over 4 days, back to back to back, where you were serving the community? What was that about? What was that all about?
Okay, so what we had to do as a medical team, or community health outreach team, was that we went to communities where we already had people in the local hospital, the Olabisi Onabanjo University Teaching Hospital. And I really want to thank them, because without them, I don't think it would have been easy. When I heard we're going to do 500 per day, I was wondering if it was, just the three of us in the medical team, the consultants, who would be doing all of that. But the wonderful team from Olabisi Onabanjo University, the medical students and residents that were there, also made it easy. So what we essentially did was to initially set up, all the gadgets we brought, the glucometers, the SIGs, and initially it was, we didn't have a dress rehearsal before then, so it took a little bit of time to settle down. But once we did and we had the flow, everything was just seamless. So it was essentially just doing vital signs, registering them under the health insurance, which they would enjoy free for a year. And then from there, moving on to do vital signs by the nurses. And then from vital signs to the labs, with the lab team, to do their blood sugar, their blood cholesterol, hepatitis screening. And then from there, moving to see the doctor and having consultations. And it was just interesting, the different diseases we saw. Particularly hypertension was something that was really prominent, like really high blood pressures that we had to say, maybe you can't go, but we also know that this is an outreach. And I think the highlight of it all was the health insurance card that we had to give all of them to say, oh, we're seeing you, we're giving you free meds for a month or two, but the fact that they can continue their follow-up care. And then, of course, after seeing us, was to go to pharmacy to collect their drugs and then pick up their cards, which again was phenomenal, because there are people, even healthcare workers, that have registered for 3 to 6 months that are still waiting to get their cards. So having to do all of that was just phenomenal. Honestly, for me, it was a good experience.
Thanks so much, Dr. Kuti. To you, Dr. Bryant, the preparation, this doesn't happen overnight. The supplies that had to be gotten and had to be brought in across the Atlantic to Shagamu. Walk us through what that preparation was from a pharmacy standpoint, and what you were looking forward to.
Indeed. So the preparation began basically with us already doing health fairs in Atlanta. That gave us the training ground to know what to do when we were here in Chicago. But here we actually had to scale up that process. So that process entailed 25 blood pressure monitors, 25 glucose monitors, cholesterol monitors, everything from PSA to hepatitis B. So obtaining those materials and bringing those overseas, for the last couple of months, I've been obtaining these materials so that I'll know exactly what we need to do once we get on the ground. But besides those products, I was also responsible for bringing in a number of medications as well. So looking at the flow of the health fair, it warmed my heart, because at the end of the day, it allowed me to provide a service to these individuals that they absolutely need. And at the end of the day, when you do health fairs, it's all about awareness. It's about making sure that the patients know what's going on in their body at that particular point in time.
Good afternoon. My name is Dr. Alan Pickens. I'm a cardiothoracic surgeon out of Atlanta, Georgia. It is an honor and a privilege to be here in Nigeria as a part of this medical mission in Ogun State. We'd like to thank the leadership in Ogun State for hosting us and providing this opportunity for us. I personally plan to hopefully provide some thoracic care, that's lung cancer, esophageal cancer care, and other illnesses of the lung and esophagus to the citizens of Nigeria. We hope this is the beginning of a long-term relationship with the community where we will hopefully be welcomed back in the future to continue to provide care for citizens in this region. We also look forward to collaborating with the local physicians to provide excellent care on a long-term basis. So thank you all very much for making this possibility for us all.
An MBBS graduate of the University of Ibadan in 1991, as has been mentioned previously. Many of the people around here are my classmates, and this is a great opportunity to give back to the country that gave much to us. So this is just the fulfillment of a years-long dream. Many of us have already been giving back over the years, so this is not the start, but this is the biggest. So like, as physicians, we deal with the whole body. So the way I see it is in the past, the head is doing what it wants to do, the hands are doing what they want to do, the feet are doing what they want to do, but we are bringing everything together as a functional unit with this mission.
A lot of them are medical officers from Olabisi University Hospital. One of our collaborating partners, they have the consultation. All of the clients right here in front of me are all waiting to be seen by the physicians. After they've had all their testing done, the physicians will have consultation, one-on-one consultations with them all across. And then after that, come on over to the pharmacy. And here is the pharmacy section where the medications have been prescribed. All along here, for those who are diagnosed with any new medical condition, high blood pressure, cholesterol, or diabetes, they get their prescriptions filled. It's a 2-month free supply and provided by the Global Health and Charity and Training Foundation. And then for those who might then need additional follow-ups, they have to then be seen at the Olabisi University Teaching Hospital.
We've always been working with the homeless, working with individuals who are uninsured, but never to this scale, never to this magnitude. One thing that I was definitely, that I learned here that I'm going to take back to Atlanta, take back to the States, is having individuals on site, whether it's medical students or physicians who can actually write prescriptions on site at these particular events. That's one thing that stood out here. The fact that they wrote prescriptions on the spot and they were able to fill the medications at the same time. So my particular organization, RxMeds Pharmacy, we donated a host of products, from the blood pressure monitors to the blood glucose monitors, the cholesterol testing kits. We did everything from PSAs to hepatitis B. So at the end of the day, providing those tools, providing those materials allowed for each and every health fair to actually be successful. As we stood at the command station and we were looking over the crowd, it warmed my heart just to see how many individuals were actually utilizing the tools that were brought over. But besides that, the fact that we're able to leave them here, leave them with the hospital so that they're able to utilize them in the future, that's added value. So at the end of the day, I appreciate you inviting me on this particular trip, and I look forward to coming back again so that we can do more.
Thank you so much, Dr. Xavier Bryant. And to you, Dr. Lajide, as a rheumatologist, working with Professor Guntano, the rheumatologist on ground, and also working with the residents that were here, I understand you were able to do some injections. What was that about, and what was the rheumatology clinic like for you?
Yes, thank you. So the rheumatology clinic at the Olabisi University Teaching Hospital takes place just once a week, Monday mornings. And as you can imagine, there's a great need for rheumatology services. So with the advent of our visit to Shagamu and environs, we're able to arrange for 3 patients to have their needs injected on Monday, while Dr. Guntano was seeing his regular patients. We had the added benefit of having up to 15 medical students clinic. At the same time, as 2 house officers and 1 senior registrar who is specializing in nephrology, that's kidney disease, but rheumatology is a specialty that overlaps with other subspecialties in medicine. So conditions such as lupus can affect the kidneys, so it was useful to have follow this nephrology training in the clinic. A couple of patients got x-rays of their knees, and also need to go through the process of reading the x-rays for the students and the residents. Additionally, also need to take them through some physical exam techniques. So all in all, it's a very productive and
Dr. Olajide, who benefits from joint injections, and what are joint injections?
So patients who will benefit from joint injections are people who have inflammation in their joints in particular. Patients have osteoarthritis as well, which is a condition generally of wear and tear in any joint. The knee joints are prototypical joints that are affected by osteoarthritis. And even though, like I mentioned, osteoarthritis is thought of as being a degenerative condition, it is known that there is some degree of inflammation. If you want to put a needle in the joint and take out some fluid and analyze it in the lab, you will find evidence of inflammation. Steroids are very powerful anti-inflammatories, so injecting the joints, especially knees, with steroids is very beneficial.
Thank you so much, Dr. Olajide. I'm going to come to both Dr. Bryant and to Dr. Kennedy Kuti. We saw close to 2,000 patients. Iperu on day 1, Shagamo day 2, Shagamo day 3 at the Caribous Palace, Alakis Palace in Abeokuta day 4, and also on day 4 at the Olowu of Owu's Palace, also in Abeokuta. Walk me through, or walk our audience through what that was about from Monday to Thursday in terms of what you saw in terms of the patient. And then we're going to have Dr. Brian walk us through the process. How did you register the patients? How are records taken? And is that going to follow those patients? So to you first, Dr. Suti.
Thank you very much for that. So yes, like I said, the first day was at Peru, and we had about just 70 patients. I remember when we got there, we really didn't see anybody initially, and we're wondering like, what get out and all that. Eventually, people started trickling in, what got out, and that first day we had about 70 people, and we had medical students, residents come join us, nurses and nursing staff. And it was good because we said it was like a dress rehearsal. I remember we finished around 1 p.m. and we said, you know what, tomorrow has got to be better. We're here to recruit 500 and we got 70 initially. We have to make it up tomorrow. And then the next day in Shagamu, which is a more, metropolitan town compared to Peru, which was more rural compared to it, was that we had, from the moment we drove in that Tuesday morning, there were a lot of patients waiting, in the lobby of the palace and all that, and they had started their registration. And we got in there and we set up, like I said, the flow was registered with NHIS, go through vital signs, go through labs, do the consultations. Of course, we had medical students supervised, and the way we did it was to pair, on each table we had 2 doctors, was to pair the medical student with the, doctor, consultants, and people came in. There were people that stayed with us all through. There were people that, just came to put in 3 hours, 4 hours of their time to see us. And yeah, we had a list of medications that we shared on each table to say, these are the list of medications we had. So we had all sorts of cases. There was an interesting person that had vitiligo that came and said, oh, that's not what I came with, but people think I'm a special god. And we're like, this is vitiligo. I remember the person showing him pictures on the internet, like, this is common, you need to see a dermatologist, you're not some god. And then there were other cases that we also picked, some surgical cases on site that, we had to connect with the surgical team, on the general surgical team in OUTH to see how they can benefit. Interestingly, there were people that had maybe gone to federal medical center, but because the NHIS card we give them and the health insurance will be for states. Some of them were like, we didn't have money. They had say, oh, you have to see tertiary. They're like, we've been there, but we don't have money. So we're like, okay, for this state, you go for the next 1 year, you can get your surgery done. You can get your eyes checked out. You can get your chronic leg ulcer done. We saw a variety of cases: hypertension, diabetes, very high blood sugar, high blood pressure, that we had to give medications and say, oh, go to the teaching hospital in the OPD and continue your care for the day and follow up. So it was really a good experience altogether. I saw that the medical students also learned, because they were coming to say, oh, I have this case, what do we do? And then, of course, pharmacists waiting for the cards and getting the cards. And then the third day, I remember also that we had like this pep talk at the end of every day to say, Dr. Akintobi would say, oh, well done, guys, we're doing well, and get feedback from all the units, nursing unit, what can we do better tomorrow, labs, what can we do better? And like, okay, let's arrange this place for the next day. By the third day, it was just seamless. It was just, the flow was just there. The patients were coming. We didn't even feel it, because what we did on Wednesday was more than Tuesday, and it was just all together.
Absolutely. And to Dr. Akuti's point, when you do community mobilization and community health events, it's about knowing your community, knowing where to meet the people. It's about meeting them where they are. And I think in the Peru's case, the community health community center was a little outskirts of Peru, and it would have taken people maybe about 1,000 naira one way to get to that location and back. And at the Acaribus Palace was right in the heart of the town. At the Lobus Palace, right in the heart of Owu. At the Lakis Palace, right in the heart of Ake. So we learned from that. But however, the point she made, which was very well made, was that was actually prep day. And so, yes, it was 70 patients on day 1. Day 2 was close to 500. Day 3 was exceeded 500. Day 4 was about 1,000. And so, but we were prepared and kind of learned through all the way. To you, Dr. Bryant, please walk us through. How did you register the patients? What kind of forms did you use? How are you going to track those results of the patients who had normal or abnormal results? Were the patients taking anything home? Is the Global Health Charity and Training Foundation going to keep any records? Is the hospital going to keep any records? How was all that put together? And the part of having them, maybe we'll have Dr. Olajide talk to this about getting those cards printed.
Okay. Hello everyone, my name is Dr. Akintobi. I'm a family doctor, a consultant in the University College Hospital, Ibadan. So I'm here all the way in Ogun State because, first of all, my cousin, Dr. John Ubo, the orthopedic surgeon in Atlanta, is part of the organizers of this program. And for me, he was the person that inspired me to study medicine in the first place when we grew up together. So I thought it would be a good opportunity to come and volunteer and give back. Also because I'm an Egba wife. So it's good to come and give back to my husband's state. I'm glad to be here and thank you for having me. Thank you.
I'm Dr. Ogundele Ibuku. I'm a pediatric surgeon and the Deputy Chairman Medical Advisory Committee for the Olabisi Onabanjo University Teaching Hospital. I'm actually very excited to welcome our expatriates and members of the Global Health International Foundation. Specifically, I want to appreciate Dr. Akintobi and other members of his team. It's a very exciting moment for us here in Shagam and in Ogun State in general to have them around. They'll be with us for a week and we're going to be having a series of outreaches in different locations around the state. And we're also going to be carrying out surgeries across different specialties of orthopedic surgery, general surgery, urological surgery, as well as cardiothoracic. I'm a pediatric surgeon. We're also going to be doing some pediatric surgical cases alongside. This is actually one of the biggest collaborations we've had. We've had a series of them in Olabisi Onabanjo Teaching Hospital, but this is actually the biggest, combining both community outreach and surgical outreach at the same time. Thank you very much.
What's going on, y'all? Yeah. Dr. Bright, what a wonderful time we've been having while here in Sukumo, Nigeria. Just basically packing up all our supplies today. With no blood pressure, blood glucose, cholesterol checks, PSAs, and There's one more test. I can't remember what it is right now. But at the end of colon cancer and cholesterol. So at the end of the day, we're here to take care of people. It's been an awesome time. Looking forward to doing it again tomorrow.
Just the technology behind that and the process of getting those cards on site, whether that was a surprise to you. But to you, just walk us through the process of getting those cards.
Indeed. I think I can start by saying, because we've seen almost 2,000 patients, you have to consider the data. You have to consider the data. So with our registration, we essentially use triplicates. One white sheet, one yellow sheet, one pink sheet. Ultimately, we're going to take the white sheet back to the States. The patient received the pink sheet, and we're going to give the hospital and the pharmacy a copy as well. And those copies are going to allow us to track those patients, to call those patients. But not only that, it allows us to build a research component to this particular project because of that data. So when you look at blood pressure numbers, when you look at blood glucose numbers, when you look at things that were just out of range, we have the ability to still contact those patients because it's about a continuity of care. We don't want to just come here to Shagamu and not have the ability to continue to follow those patients, which is essentially why we're leaving all of the supplies, the blood glucose, the blood pressure, and anything else that we can leave so that the staff can actually continue to follow and monitor these patients, and they have the supplies to do it. And these patients can actually be seen and receive those results so that they can improve their outcomes, because that's what we ultimately want to do. We want to continue to follow these patients. We want to continue to improve the outcomes of the people of Chicago.
Thank you so much, Dr. Brian. We'll be remiss not to give credit to Matron Adekoya, who had a phenomenal team. Used to do community mobilization and community health outreaches, always on point, and it starts from the top. We'll be remiss not to give credit to Dr. Afolabidosu, who is the head of the State Health Insurance Scheme, and Dr. Gushala, who is the head of the Community Health Workers in Ogun State, having all of their staff ready to go. But to you, Dr. Lajide, you were there at the community outreach at least 2 of the 4 days, and the other days were in clinic. How impressed were you with the State Health Insurance Scheme? How impressed were you that you had those cards printed on site? And what process does that entail?
Thank you. So, yes, it was very heartwarming to see the process going seamlessly, like Dr. Kuli described it. I have been on a medical mission just once before, but not in Nigeria. I was in Zambia in 2013, and it was always my vision to do a medical mission trip in Nigeria. So this is a dream come true. So the technology of printing the cards on site was very impressive, and I actually had a good discussion with Dr. Musun and walking through from start to finish. It was a pleasure to be a part of distributing the cards when they were printed. So very impressive.
And what do you think that card in hand means? What do you expect?
Yeah, it means a lot because, like was mentioned earlier, one of the patients where they are. So having something tangible goes a long way, because with completion of the registration process, even without a card being printed, the patient is in the system. You can tell them, yes, you're in the system, but there's a big difference from you telling them they're in the system, they having tangible proof that they're in the system. So it's very encouraging to the patients to follow through. They can see the information in front of the card. We have a located primary care center in front of the card, and there's information on the back of the card, including telephone numbers that we contact with questions or concerns. So all in all, very impressive.
Wonderful. Thank you so much, Dr. Lightly. And so, to you, Dr. Kehinde Kuti, consultant family physician from UCH, what was the highlight for you?
Honestly, for me, I think it was the card difference. Because, like I said, many folks have been to outreaches, you go, it's a one-off thing, people get drugs, you know, but the fact that they get health insurance, honestly, because In my hospital, I'm very familiar with the health insurance, and the benefits that people can have from, paying as much as maybe $8 a year, and, getting opportunity to have tests like CT scans done, even if it's not fully covered, but, being able to change the lives of people, honestly, beyond, if we had done that outreach and we're not giving medications and they're just come to collect the card without us doing any consultations, that would also have been really super. So for me, honestly, that was a highlight, collecting that card, apart from the, some other important, how would I say, cases that I saw.
Can you give us an example of an important case?
Okay, so I saw this young man who had said he had gone to, I'm not sure if it was Federal Medical Center, but he had a collapse. And he actually came because we couldn't examine the blood picture. And we had to say, link him up with the GIT team. So just to let him know that now that you have a card that can take you to primary care, once you go to the health center you've chosen, they will definitely refer you to the secondary clinic, I think it was General Hospital in China, and you will end up with those. And I know we had a gastroenterologist on the team, and even when she gets back to the US, there's a gastroenterologist, Dr. that we can connect with. So we got his data and we're going to link him up so that we can actually get there. So that for me, honestly, was your highlight.
And it's about connecting the dots, as our specialists have said. There's no question, too, let's be clear to our audience that the cost of covering this health insurance that we're talking about is not going to break the bank. With less than $50, you can cover a family of 4 in Nigeria for a whole year for health insurance. With $10 or thereabouts, you can cover one individual for a year with health insurance. This is why we're asking and imploring our audience to support our effort. GHCTfoundation.com has all of that information on there. As part of this medical mission trip, everybody that was newly diagnosed with a medical condition on site, which we're going to track, got prescription medications for 2 months, whether it was high blood pressure, whether it was diabetes, whether it was high cholesterol, they were given medications. Yes, they got the insurance card for a whole year, but they had prescription medications for 2 months to get them situated, because there was a case out of Peru, somebody whose blood pressure was off the charts, was not recordable by the machine. It was that high, meaning that the top number systolic blood pressure was probably over 300. And Dr. Kuti saw the patient, made a decision to give her medication, and when she came the next day, from Peru now to Shagamu, she came from Peru to Shagamu, pressure was now recordable. Yet still very high. And guess what? We had a cardiologist, or 2 cardiologists who were on site, in Dr. Badiwa and Dr. Nafewe, and they took the case from there. We've talked about the medical piece. We were in Abeokuta, Dr. Xavier Bryant, being your first trip here. What was the highlight for you, medical or non-medical? You were at the Alake's Palace. You were at the Ologu's Palace. We're talking about connecting people and connecting dots. Was the highlight for you, was it medical or was it non-medical?
To be completely honest, the highlight for me was just the sheer volume of people that actually came out to be seen, to receive help, to receive health care. And out of that volume, the number of men that actually showed up. And the reason why that's important to me is because in the States, especially when it comes to African American men, we don't come to these types of things. We don't come to health fairs, rarely seen to the doctor. So to see the sheer volume of people and to see the number of men who came out there who were actually able to receive a PSA test, it warmed my heart, because at the end of the day, it showed that this culture actually cares, and they want to come out and they want to receive that type of help. So, and then it allows me to understand how to scale when I go back to the States, from a perspective of not only just 100, not only just 200, but 400, 500 individuals, knowing how to prepare for that, knowing that the amount of materials that we actually need. As a matter of fact, on the last day, which was yesterday, we actually did 2 health fairs at the same time. So knowing that we had enough supplies to split between 2 different groups where we're doing hundreds of individuals at the same time for our inaugural event, it told me that not only was I prepared, but we were prepared to take care of thousands of people, and in the future will be even more.
Tell us about that visit to our Cape with the Royal Highness of Badebo before, and being in his presence and the connection that you made, because we ended up being given 2 Nigerian names.
Right.
Omot Wale, Omot Tunde. What was that like for you?
I was full. I was full of emotion. I was full of pride. I was full of joy. And I was actually hungry that day. I wasn't even hungry anymore because that experience was enough to fill me. Knowing that he gave me his blessing, knowing that he told me that I would never fail, knowing that coming back home to Mother Africa, that I actually had a connection with the individuals, not only on this mission trip, but I felt like I was connected to the people. I saw individuals with my nose shape, my lips, the shape of my head. It just astonished me. And so for him to give me those names, for him to tell me that a child has returned home, it almost made me want to cry on the spot, to be completely honest. It was a very emotional experience for me. And for the first time in my life, I felt like I was connected back to my mother.
Dr. Lajide, will you do this again?
Absolutely, without hesitation. This is the first of many special grace.
What does the future hold for Global Contract and Training Foundation? How do you sustain this, Dr. Lajide?
The future is bright. The feedback that we're receiving even before we depart from the shores of Nigeria is very encouraging. I've shared videos with my family, and they're very impressed. So we are going to have support moving forward. When you have determined individuals aiming to get to a setting, then there's nothing more.
Dr. Bryant, can we do this again?
Absolutely. I'm gonna be here every time we decide to come. But not only that, I look forward to bringing back more pharmacy, bringing back more different types of medications. And in addition to that, I also know some dentists so that we can bring in other specialties so that we can provide more added value to this particular community.
What you've not shared, Dr. Bryant, is about connecting dots and connecting people. You run into your classmates in a Peru, state. Tell us about that.
Yeah, I ran into one of my classmates and I felt that it was alignment because you're here with a number of your classmates. So to find one of my classmates, it was like, wow, this was actually supposed to happen. And the fact that we were able to connect on not only a pharmacy level, but an entrepreneur level. Because not only am I an entrepreneur, he's an entrepreneur as well. So we now have plans to bring a variety of different healthcare opportunities to Shagamu and to Nigeria in the form of pharmacy, in the form of lab services. So at the end of the day, it was a very special meeting. We haven't seen each other since 2011. So to see him on the spot, he actually didn't recognize my face because back in the day, I used to have locks. I had locks. I mean, I'm bald now, but I had locks then, right? And the first thing he said to me was, Xavier, where's your hair? And I was like, look, man, that left a long time ago. But at the end of the day, he was able to actually provide us with some materials that we needed that first day. And as Dr. Kuti stated, that first day was more so like a run through. It was a run through. It was a test to see, are we prepared for 500 individuals? And honestly, that's just God. That's how God sets things up. So we had the ability to test out our scenario, test out our materials, see the flow, and then come with a better scenario the following day. Each successive day became more and more smooth, more and more efficient, and it actually became easier with even more individuals that we were seeing.
Lessons learned, Dr. Kuti, and are you going to do this again?
Sure, absolutely. I will do this again. I'm hoping you can come to my hospital so we can host. But I'm going to do this again, and I'm going to, motivate my colleagues who are interested with the alcohol, that don't know about this. I will definitely take this, like the videos and all that, for people to see and, prepare them for the next one. Definitely, I know many people want to volunteer for this. Lessons learned, I think, um, just looking at everything as a whole, I mean, it was a good success, but I think I would learn to, in terms of, and it's not so significant, but in terms of just like, refreshment for the team on ground, getting things ready, like maybe outsourcing so that there are no delays and all of that. I know at some point we had, which is not unusual, but you can see that even when people were visibly like, oh, where's the drink, waiting for it and all that, people were still committed. We just kept going. So, maybe outsourcing that, but altogether it was really good missions. I will definitely praise it there.
Thank you so much, Dr. Kuti, Dr. Bryant, and Dr. Olaji.
It's an exciting day. We're here at the community health screening event at the Akintobi Palace in Shagamu, here in Ogun State, Nigeria. Take a look at behind me. These are folks who are waiting to be seen here today. We have over 1,000. Do you hear me? 1,000 clients waiting to be seen. We're checking blood pressures or the vital signs. We're checking their cholesterol. We're checking screening for diabetes, alongside with colon and prostate cancer screening. This is absolutely exciting. Come on in. And look at the operations in here, ladies and gentlemen. This is a big reception hall. Right now, we probably have close to over 500 people here. And we have the others who are waiting to be seen. All of them have been issued numbers by the Ogun State Health Insurance Scheme. They are the ones right here on this table, Ogun State Health Insurance Scheme, registering all of the clients coming in for the Ogun State Health Insurance. Remember, we're covering 500 entities of Ogun State for the Ogun State Health Insurance Scheme. After they're done and their cards are issued, we're getting the master strength all on this row. Blood pressure checks. We have all our nurses who are doing this for us. And we have our lab technicians who get their blood drawn for the point of service care, for their cholesterol, diabetes screening, and also hepatitis screening too, also offering that. Akintobi Palace in Shagamu. And believe it or not, we've just concluded seeing over 600 patients here this afternoon. It's all clean now. We had over 80 volunteers that included nursing students, nurses. We had medical labs scientists that helped us out. We had some medical officers, about 6 of them, and we had the pharmacy section. It was a fantastic flow, much better flow than it was yesterday, with a lot of 550 who got their health insurance, Ogun State health insurance policy that will obviously give them insurance coverage for a whole year. For those who are newly diagnosed with certain medical conditions, they also got their prescriptions today. We had individuals that had their blood pressure that was unrecordable, over 300 millimeters of mercury for their systolic blood pressure. And that is the kind of scenario that we had today. We had someone that had a high blood sugar of over close to 600 here today, non-diabetic. And the beauty of all of this is that despite the treatment that they're going to get today, they also will now be plugged into the Ogun State Health Insurance Health Service. Dr. Sikiru Adebayo leads our urology team. He's also been in the OR. He had 2 uroplastic surgeries yesterday, and he has 1 prostatectomy scheduled for today. Dr. Shina Faole, heading our general surgery unit, has had some hernia repairs. He has 2 gallbladder surgeries today that is also operating. And we also have the pediatric surgeon in Dr. Gundele, who has been working with this team feverishly. This has been a fantastic experience. We wrap up here in Remo land after 3 days of outstanding service given to the Remo people. It's been a wonderful day. Thanks to all our volunteers, about 80 of them that we had today. See you soon.
Now that you heard the facts, apply the knowledge. Contact your doctor or healthcare specialist. Scan the QR code to provide more information on today's talk. See you on the next We Shop Talk, Africa.